It's nice to see some familiar faces in the audience. Michael, you all set? All right. Yeah, exactly. I'll stay in one spot. Take it easy. Okay, well, for those of you who don't know me, my name is Jeremy Countryman. I am the program director of the Family Café. I have the unique privilege of being one of the few people who gets to put on the conference and do a presentation as well, so that's exciting for me. As you all know from looking at the program, this session is a roundtable about mental health. So, first of all, before I introduce Heather, which I'll do shortly, I'll just tell you a little bit about our format, and the format is this. I am not going to stand up here and talk for an hour. Neither is Heather, unless she has prepared remarks like I have. The point of this is to have dialogue for people to share with each other, share experiences, solutions, those kinds of things, kind of like the conversation you were just having back here with the entire group. That'd be entirely appropriate and the reason that we're here. Let me tell you a little bit about the Family Café's involvement in the mental health arena. We have a pair of grants from SAMHSA. For those of you who have never heard of SAMHSA, has anyone never heard of SAMHSA? Okay. It's the Substance Abuse and Mental Health Services Administration. So it's part of the Department of Health and Human Services. So we have two federal grants through SAMHSA, one of which is for adult mental health, and it's to operate something called a Technical Assistance Center. The way that grant works is SAMHSA assigns you states, and you go and work in those states to promote adult mental health organizations, help them get up and running. That's a program we call the Café TA Center. We've been doing that since 2010. The states, just if you're curious, that we operate in under that grant are Mississippi, Louisiana, and Utah. Our friend here in the back, John Ferrone, is a consultant who does quite a bit of work for us on that program, so we're happy to have him here with us today. The other SAMHSA grant we have that is statewide is the Statewide Family Network Grant, and that's basically a grant to do information and referral for children's mental health here within the state of Florida. So we fulfill a lot of the work for that grant through this conference, through our mental health track here. We also do information and referral throughout the year, and are kind of networked with other groups in other states who are doing similar work. So we kind of have a commitment as an organization, and always have had from the beginning, to the idea that you're better off having as large as a tent as possible. So we don't make a lot of distinctions between ages or types of disabilities. So one of the things that we're trying to do is bring the mental health community into the larger disability community. So everybody can learn from each other and work together and all pull in the same direction. There's water in the back if that helps, if you need it. So, end of my spiel. If you're curious about our TA Center, I have some brochures about it, which I'll put up here if you want one. And the other thing that we get to do is make t-shirts. So I have a whole box of them to give away. So does anybody want a t-shirt? There we go. This is my ice cream. Yes, one size fits all.
Too big.
Yes, wear it to bed if it's too big. Wear it as a headscarf if it's too small. That's two. Go pass them back. Here you go.
No.
Oh, thank you so much.
Yeah.
What?
We need one more.
Oh,
We have one more?
Well, I got more here.
Oh, yeah. Oh.
Over here.
Now, in the event I go through all of these, I have more downstairs behind my booth. So
Yes, ma'am.
come on down and get one from there.
I'm waiting to see if he forgets you again.
What do y'all do with the mental health in the schools? Do you do any presentations at school?
No, we don't do presentations.
Are you not doing any collaborations with the schools? I feel they get a t-shirt.
I know, I'm getting to you. Man.
I'm not a big.
I'm going to get a 0 on my report card from you, aren't I?
Make her mad. I gotta sit by her.
I love you. I will do that to you.
You want one?
Are you doing any collaborations in the school?
Thank you.
Or is that not under your?
Well, all right, anyone else that I missed? Yes. You want a t-shirt?
Yes.
No, yes, no, maybe. Of course, the grandma always gives us one.
Yes.
Come on.
We'll take a photo op from the retro.
I'll wear it.
Exactly.
No.
So yeah, in terms of what we do with the schools, we don't, because of the, it's not within our scope like to go to individual schools
Yeah.
and do presentations at them. We do a lot more information referrals. People will call into us and say, hey, I have an issue with my school, and we find people in that area that we can connect them with to help them solve their issue.
But you do know about the SEDNEC program that
Yeah.
the system has.
Yeah, and in fact, they're here this weekend.
Yeah.
So that's part of coordinating them, kind of getting them in this venue is one of the things we do. But before I go any further, I want to introduce Heather. Heather, for those of you who don't know, has been a long-time advocate and expert in the mental health community here in the state of Florida. So Heather, why don't you go ahead and tell them about your background.
I'm Heather Hawk. I'm the parent of a child with autism and mental illness, and I'm also what's called a peer, an adult living with mental illness as well. I am the statewide trainer for a program called Peer Specialists. Peer Specialists are a Medicaid billable profession where adults with mental illness work with other adults with mental illness to help them navigate the system through recovery because they've been there and they've done that. Peer specialists can also be parents of children with mental illness and help the parents and family navigate the systems. So we just became Medicaid billable. We've been waiting about 4 years for it, so it's huge for us. And it's actually a statewide certification. My job is I work on a statewide project called CLEAR. It's Connecting Leadership, Education, Advocacy, and Recovery. An acronym suck. But what we do is it's a statewide project where we offer some trainings across the state to train leaders, not like regular programs, but just to train the leaders. And then we offer an information and referral line. So the business cards are up there. The information and referral line is an 800 number. We used to be 24/7. I don't guarantee 24/7 anymore, but if you call me in the middle of the night 3 times, I'm still going to answer your call. But what we do is we're not just going to do that information and referral where we say call such and such, right? You've probably already called 10 people before you got to me. So what we're going to do is we're going to make sure that's the right referral, and if we need to, call the agency on your behalf to make sure we're making it and you're not getting stuck again, and just say, hey, call such and such. The unique thing is every single person that answers our phone is either an adult with mental illness who's a peer specialist or the parent of a child with mental illness. So we work and we connect everybody to just about everything. I mean, I've gotten calls from diapers to I'm in the crisis unit to a lot of, like Roz was saying, my kid's having problems at school, what do I do? So you never know what we're going to get, but we are there and our number's up there, and most likely you'll get me, but I'm here for you.
Great. Just out of curiosity, one of the things that we deal with a lot in the TA Center and working with our states that's similar in Florida is working with peer specialists. So how many people here are familiar with what a peer specialist is or have heard of that?
That's what you get for coming in late.
Okay. Well, maybe we should talk a little bit about what that is.
Sure.
Because, like I was saying at the beginning, one of the ideas behind the Family Café and our approach to mental health is to put a lot of different things together so people can learn from each other. So in addition to putting mental health in the larger umbrella of the disability community that is coming here together this weekend, putting the adult population and the child population together and seeing what those groups can learn from each other, I think is also useful. One of the things that's gained a lot of traction over the last couple of decades in adult mental health is the concept of peer specialists. And like Heather was saying, this is now something that's become a Medicaid billable service. So it's become professionalized to some degree. But the concept behind it is essentially that someone with lived experience, someone who's been through something, gets to work with and mentor another individual who's currently going through it. So much as you come to Family Café and you meet other families who have, you know, a similar person with a similar disability in their family, or live in the same community, or whatever relationship you have, you can learn from them. The peer specialist relationship is a slightly more formalized version of that, where a person who's an adult with some mental health experience goes through a course where they learn how to essentially become somebody who's able to be part of a treatment team for another individual with a mental health need. So the concept behind that is, you know, traditionally you have what you would call sort of a medical model, right? I'm here, I have a mental health issue, so I need to go to a doctor, or I need to go to a hospital, or I need to get a medication, okay? That all those things are useful and can work, but what the peer specialist adds to it is that peer-to-peer relationship where instead of being a dynamic where I, as the patient, am dealing with some kind of power structure where the doctor's the authority is telling me what to do, I'm dealing with somebody who's on the same level as me because they've gone through that experience themselves. And one of the reasons that's a successful model is because the individual who's experiencing the mental health need at the present knows that they can be comfortable and open with the peer specialist that's working with them because they have that shared experience to work from. So that's something that is becoming more and more popular. It's becoming part of, in addition to being a Medicaid billable thing, you know, there are HMOs, private health insurers, who are looking at this as a model that works well. Because from a financial standpoint, it's going to cost them a lot more money to have somebody in crisis in an emergency room than it is to have somebody living in the community. Just dealing with somebody who's a peer specialist that's talking to them on whatever regular basis they need and helping them get their needs met without getting into that crisis area. Yeah?
I have a question about the Medicaid billable part. Do you have to have a referral from your PCP in order to use the service?
They are the handbook like really just came out,
Okay.
and as it stands right now, it needs to be provided by like a community mental health center or a drop-in center or a clubhouse or something like that, because peer specialists are required to be supervised by a master's level specialist. So about the only place we get that is there, but anyone going can say, you know, hey, you know, I'd like to see a peer specialist. The need for them is going to grow now that it's billable, because for the longest time, like one community mental health center would have one peer specialist. I don't know what one could do for people, really. It's just one person. But now places like my county, right, has 14 peer specialists at Salix Care. That's what it's called now. Collier County, our local NAMI affiliate, almost everybody employed is a peer specialist. So it's getting out there, and there are more doctors that are making referral for it.
Yeah, because one of the things that I've seen, both in Florida and in other states that we've worked in, is that you'll see people who, you know, will go through some kind of mental health crisis experience. They'll come through it. They'll say, hey, my experience can help other people. They'll hear about this training. They'll go become certified peer specialists. But then there's no infrastructure to sort of employ them and connect them with people out there in the universe that could use their services.
Yeah, after they take our class, they need 1,000 volunteer hours, and if there's nowhere set up to get that done, they can't become certified.
So this is kind of something that's been growing over a period of years nationwide, and it's now kind of at the point where it's got enough momentum that it's developing to the point where it's going to be Medicaid billable, and, you know, health insurers are looking at this as a more cost-effective way to provide treatment, so it'll probably become more common.
DCF is requiring a peer specialist to be on all community action teams, like the FACT teams, must have a certified recovery peer specialist. They're also starting the children's assistance teams, I think is what they're called, they're required to have a peer specialist as well. And child welfare is now starting to hire they're going to our training, but they have to have been involved in child welfare, the parents have, and then they're going to be mentoring other people through the child welfare process.
Right. And that's a good point, because one of the reasons that I think this is a cool idea is because it works in a lot of different venues, you know. And in some sense, it's not unlike what the Family Café has been doing for a long time, trying to put a lot of people together so they can learn from each other. There are, you know, peer specialists in the adult mental health community. There's also, you know, in the parent community, there's parent peer specialists. That's a thing that's out there in the world, and I don't know that it exists that formally in
We
Florida.
have certified
There are-
recovery peer specialists
yeah.
for family.
Right. So getting connected with those kinds of things, it's a way that the whole system is sort of trying to get reoriented to include the value of having somebody with lived experience as part of a team, as opposed to just having, you know, a bunch of professionals telling you what to do, because that can be kind of disempowering, as probably some of you know if you go through it. Yeah.
My question is, if you worked at a place like G. Pearson Wood, Memorial Hospital, that's
Yep.
a hospital in DeSoto County where I'm from, would you recommend that maybe volunteers or somebody like myself is able, but there's a lot of people that are out of jobs because they don't have that facility there.
Yeah.
And we were getting college degrees. I had
Yeah.
to be a supervisor. When I was there, there's some that's gotten other degrees where they're over different wards and different shifts. So would you, how would a person like that, with a background like G. Pearson would, be able to get into something like
Well,
specialist?
I'm the state trainer, so you have the right person.
Oh,
That's why she's here.
It's a training that costs $100.
What, ma'am? What, Roz?
It's a training that costs $100.
My training doesn't cost anything as long as I
But
can
your
get.
training is in Lee County too.
If I can get somebody to have my training, I'll train it anywhere. I don't need money. Just pay my hotel room and my books. I don't care. But the cards are up here, and that's one of our things is to increase the number of peer specialists being utilized across the state.
And the VA does, and the VA, can I throw this out since
Oh, yeah.
you pointed it out to me, the VA does use.
Oh, yeah. And
In fact, that's another area where there's a big growing need. You know, I mentioned the adult population, the family population, the veteran population. I think is probably one of the areas where you see a lot of growth in the coming years.
And I will say, as somebody that was not in the military, I learned a lot by teaching a veterans class. I learned more than they learned. So, but the cool thing to be a veteran peer specialist is they are not required to have a diagnosis of a mental illness. They have to have the lived experience of being a veteran, and then they can work with veterans. Now, if they want to work with adults with mental illness, they got to have our diagnoses, and then they can be both. So it's making sure that the person you're with can relate to you. And it works out really well. I mean, there's stuff you'll tell a peer specialist you'll never tell a doctor, or they'll not understand. We have family members all the time, so like, oh, I get calls, they won't take their medication. I don't know what's wrong with them. They're falling apart, they won't take their medication. And when I ask, well, why don't they want to take their medication? The response is, I don't know, they just don't want to. It's like, okay, but there may be reasons. Let's find out the reasons, and then we'll go from there. And when I work with the adults, parents, sometimes it's like, oh, I never thought of that. And if you don't ask somebody with a mental illness, why don't you want to take your meds? You may never know, and just say, well, they're not. They have reasons, and we need to find out why, so what we can get what they want.
My neighbor told me they make her feel normal.
And you know,
And
with
she's
good
bipolar, and
Yeah.
she cycles for 72 hours at a time. I mean, and being her friend, I tried to help her. I told her, I'm the one that needs the pills, you don't need them.
And as somebody with that lived experience, I can tell you, if I go manic and it's not too high, that's the most amazing feeling in the world. I'd love to stay there every day of my life.
Yeah, I'm not gonna do this 24
But you
hours.
take those meds and you're like
Yeah.
flat.
Yeah, she said it makes her feel normal, and I'm like, hello?
But it's not normal like you.
Okay.
It's normal like, I'm a soldier, I'm a robot going from the line. You have no emotions or feelings. So when you find out why, it makes sense. And you can say, you know, there's other meds out there. There's other methods. Have you heard of meditation, mindfulness? All this other stuff's out there. But if we don't know why, and we don't ask questions, we never know. And that's where I've seen the peer specialists be crucial.
And the big issue is also now is insurance and the money to pay for the meds.
That's why you call me. Well, let me just say that again, Ross. Call me.
Call you,
Call me.
call Heather.
Call
I
Heather.
hear that, call
I have
Heather.
a question. I don't know if you can answer.
Sure.
I have bipolar.
Uh-huh.
When I was younger, I was diagnosed as being hyper. Could somebody that has bipolar now had it when you were younger but didn't see it?
Most definitely.
Misdiagnosed, right, when she was younger?
I told this last year, I'm not going to tell him diagnosis. I'll tell you, my son and I both probably have 10 diagnoses each. Because it depends on who sees you, what day, what mood you're in, what they're looking for. Are the meds working, you know? Did somebody make you upset? You know, did you win a lot? So a lot of the times they're just trying to look at how you are right then and make a determination.
Is it true it can be hereditary at times too?
The thing about diagnosis in general, I think that's interesting to think about, is that one of the reasons that diagnoses exist is because it allows you to put things into categories, and then if you know what category something is in, you know how to treat it. One of the ways that the mental health world is sort of changing is that instead of looking at these diagnostic categories where we're trying to have a cookie cutter approach where we're going to, if this person fits this box, we're going to give them this medication and that's solved. People are coming to the realization that human experience is a lot more complicated than that. And, you know, like Heather said, you could have 10 diagnoses. I could have a different diagnosis depending on what hour of the day it is when you talk to me, as John knows from having called me on the phone during the workday. So, asking the person sort of what's going on with them, what they've experienced, why, it allows more depth than, you know, trying to have a set of symptoms that just fit a diagnostic category where you can just treat it.
And it's, when you look at medications, you're not looking at, okay, if you have bipolar, these are your medicines. It's going to be, if you have a good doctor, it's going to be, these are the symptoms you're having, and these medications may help. And as long as you break it down based on symptoms, that's where you want to be. Not, okay, you have bipolar, you're going to take a mood stabilizer, anti-anxiety, and all that.
Right.
You want it to be what fits what's going on with you right then, because that could change a week from now. And if we're just basically medicating you based on your diagnosis, it could be all we want.
Thank you.
I have a complicated situation, and I've tried to negotiate through the system for my young teenage son, who was adopted. And we know that birth parents' maternal side has bipolar several generations. So there's that possibility that something unknown we're having. And we're to the point where within the school system restraints 15 since October, and almost a Baker Act the last week of school. Yeah, I know. Oh my goodness. But there's also a diagnosis of Down syndrome, autism, and explosive disorder. So, where do I get help? Because they're saying, no, can't treat you.
Okay, so here's my first question.
Yes.
What funding source do you have?
He just got on the way.
So you have Medicaid, right?
Yes.
So has
And
anyone...
Medicaid won't allow them.
Yeah, no.
Yeah.
He's on Medicaid, right?
Right.
He qualifies for up to 140 hours a month of applied behavioral analysis.
Okay, you got that.
Uh-huh.
Not that high level, but he's on behavioral. And then tell me, because CMS told me they have parents. So see, we're trying to educate the community that if you have a diagnosis of this, then you can't get this. If you got behavioral health, then you can't get medication treatment. Where are the state guidelines? Where
And
can I look?
it is in the brand new released Medicaid handbook. There is one on community behavioral health services and behavioral health overlay services. And the reason I know this is I'm having this fight right now. My son is dual diagnosed. He's in a group home for autism because his behaviors are so severe. He's been traumatized. Who's going to provide him counseling? Well, go to the community mental health center. Well, they're not qualified to treat him. Well, then you're out of luck. I'm like, so you go to APD. I want specialized mental health. They're qualified to treat. Well, we're the payer of last resort. Go to Medicaid. CMS is supposed to be for children with behavioral, physical, and emotional disabilities so that they receive specialty services. My question today was, what were your specialty services?
We've got ADA therapy.
That's your Medicaid, yes.
Yes. And I'm just into CMS, so now we'll be researching. But that was the social worker that told me that. So he's accessing Sequel Health, which is in our area, which is a mental health provider. And I was told from it, there's no therapeutic needs which benefit our community of individuals. So therefore, and Medicaid will not provide that. So, you know, you're out.
Okay, is he verbal at all?
Yes.
Okay. They changed the handbook. They changed the handbook. It actually used to say,
3 years.
the old handbook, so it just changed like 2 months ago. It used to say if your child had autism or developmental disabilities, they didn't have to provide community mental health services. It now specifically says if they are unable to benefit because of their cognitive something.
Right. That's
So
what they're saying.
that's what it says now. Well, if he's verbal, can have a conversation, he can benefit from therapy. They just need to find the right one. So you can call me because I'm in this fight right now because I'm what's called EPSDT services, which everyone says in Florida does not exist.
Say that again.
EPSDT.
VT.
Early Periodic Screening, Diagnosis, and Treatment. And it's a federal mandate that anyone under 21 on Medicaid must receive appropriate services to treat their diagnosis of disability. So, I'm in that fight right now. Just enjoying
We'll
it.
talk.
Okay. Outside of the Medicaid issue, under IDEA, 3 to 21, 22, depending on birthday, they are supposed to provide least restricted environment, not beating them, not suspensions, not detentions, and all that stuff. They are, least restricted environment means day treatment and residential placements. And guess what? If it isn't in the state of Florida, you can ship them out to other states. And they have to pay. Because I'm an advocate who shipped 3 kids from 3 different school districts in New York to the Brown School in San Marcos, Texas. All 3 were most likely to do a Columbine. These kids were violent and dangerous, and I put them in the most restricted lockdown facility in the country, which is now just called the San Marcos and the treatment center. And the school district pays 100%, provides all, not the Medicaid and none of that. So these children who are on these med waivers waiting for stuff is a violation of their IDEA rights because they're not receiving the services the school district is supposed to provide. The other thing you have to watch out for is the child study team. The child study team is a thing the school district does, and they suspend the child and they don't do referral to special ed to be evaluated so they can get classified and get services. So that's another thing that they do, and instead they do suspensions and detentions. I got 2 of those right now. And the last one is if your child is under 3rd grade and hasn't failed the FCAT twice, they refuse to evaluate your child so that they will Matthew affect the child, which means that the child's IQ will go down because they are in the 3rd grade reading on a 1st grade level and they should be in the 4th or 5th grade. So their IQ drops artificially, and then they explain to you all these problems have been because the kid's retarded. And next we tried with your kid, but you know, let's go stick them in the varying exceptionality class and just dump them there and not provide them with an education. So your kid ends up having mental health issues because of what the school is doing. The resolving of this, impossible in the state of Florida. The due process hearing system is corrupt. The administrative law judges are DKS on IDEA, and I won't explain that, but I have them in transcript violating the law, because who gives a damn? Kids are worthless in this state, and they just destroy them. So that's what you're supposed to be doing.
Well, the good thing is a lot of people don't know this because our school districts don't share any information.
No.
Is every student in the school is supposed to be on RTI, the response to intervention process.
Right.
And any student, we're not talking disabilities, any student struggling, they're supposed to start taking data and start taking interventions. And there's a couple different levels, and the good thing about it is everything in RTI must be evidence-based. Your IEP accommodations do not have to be evidence-based. RTI must be. But what they try to say is, oh, your child's in RTI, we don't need to do anything, we're just going to do RTI and see how it goes. Well, but that's when parents at any time in writing can say, I would like an evaluation of my child. Once you start that evaluation, they must evaluate your child to see if there's additional services.
In writing.
In writing.
Yeah. In
writing. And sign the consent. But I will say, we're talking about police restrictive. My son, APD will tell you, DCF everyone will tell you, was one of the most severe children in the state.
I'm sorry, I have a situation. My son was originally in Florida with me. He was with me for about 4 years. He was going to Crest in Citrus County. He was back and forth from Crest to the high school, trying to get him into mainstreaming. He has very bad behaviors. Crest, he was finally in Crest, and they're like, oh, we can't do no more for him here. Can he go live with his dad in New York?
They actually expelled him
when I
from
did
2
that,
schools.
I sent him to his father with hopes that he would go to a regular high school or the high school with a program that would fit him. They said they can't take him there because he's behavioral. Now he's in BOCES and not doing anything but having free time all day and a floral class.
How old
and
is
he's
he?
not learning anything. He's going to be 19.
I'll be back up in New York in August. Take me in and take care of
Yeah, because he's still qualified
Because
for an
he's
IEP.
now my ex is, he doesn't know what to do. He's like, he wants him to
He
prosper,
tried,
he's
and you
not.
know what they told him? This is what we're doing.
No,
In
no,
New
no.
York, apparently, unlike here, you don't have a choice. They don't, you know, like they said, they passed a new law here, where you have to sign off on it. They don't have
They
anything
don't
like
have
that
that
up
over
there.
there. They really don't.
No, they do. They have.
They do. If you don't know your rights, they will trample all
And
over.
we just have to mention my name in New York. It's not like
Well,
Florida.
what I was going to tell you is, it's kind of like Stan. So what I was going to tell you is my son was considered one of the most severe students in the state of Florida, and it was horrible. Life was horrible, right? And he was restrained. I mean, I have reports he was restrained 5 hours a day at school. I mean, locked in closets, you know, all of it. Last year, he was in a one-room private school with a teacher working on his own in 3rd grade level, right? Restraints every day. My son, he started 9th grade this year in a regular high school, and I thought they were absolutely nuts. Right? My kid that beats everybody up, threatens to blow up the school, is violent as can be, broke every bone in people's body, stepped into a 9th grade school after not having been in a school for 6 years. Right? He just passed 9th grade. Not a single behavior in gen ed classes the whole year. Not a single restraint. So the restraints really do. It's trauma.
Yeah.
It is trauma. And it adds up. You fear people. You don't want to be touched. If we treated adults that way, they tell me, oh my gosh, we went up to him and he hit us. Okay, if I go to restrain Jody right now,
We can blame him, yeah.
it's common sense.
I'm tired of parents who say I'm afraid to go to due process because I don't have an attorney. You're supposed to have functional behavioral assessments to do positive behavior intervention plans. So what you do is you don't argue about the suspensions or the restraints. What you do is you say, they're not following my child's positive behavior intervention plan. I want a due process hearing because restraints is not a positive behavior intervention, and I want a due process hearing on it.
Are you getting your
Simple.
reports?
And
Okay.
you get
Wow.
them. And you say that it's, yeah, it's not right, I want a new FBA, I want a new and you keep doing it.
All right, I gotta ask, in New
Yeah.
York, the behavioral people that work in the schools,
Right.
what are their qualifications?
Oh, pathetic, like here in Florida.
High school diploma?
High school, well, you know, no.
Maybe one class in college, but
Teachers,
nothing major.
teachers have to have a master's
Oh, yeah.
degree within, I think it's
Yeah.
6 years, and you have bachelors. No, to be honest, these
No, I mean working as like the behavioral
Behavioral
staff.
specialist.
No. They're bachelor's
Ours
degrees,
are
they're
high school.
teachers. Yeah, here,
Like the
yeah, well, an
APD class.
associate's degree, you could be a full-time teacher in Florida. I know, I have transcripts under oath testimony.
Hey, I'm trying to get them to hire me as a behavioral specialist.
Yes, I could have been a full-time teacher with an
I am.
associate's degree in liberal arts, but they won't let me go to school at all. Anyway, the thing is you've got to go to due process, you have to fight. And even if the fact that the administrative law judges won't let you win, you have to keep doing it.
So 2 good points from that. Downstairs, there's the ESE parent survey.
Right.
Fill it out. Also, I have surveys in the back for Disability Rights Florida, so they know what you want them to focus on next year. And they do a lot of education law and a lot of mental health. They are also downstairs.
There's I believe, hopefully it hasn't happened already, but I know there is at least one session on positive behavioral supports here this weekend. So I'm not sure when it is
And
on
I-
the program. Pardon?
PBS.
Yeah.
There's something on keeping your behaviorally challenged child in school too.
Yes.
And the other
Yeah, that's
thing
in there as
to
well.
remember is we have a new law in Florida. They cannot put your child in a center school unless you sign. So they can't say, oh, they're going to the SED school over here. I'm not signing that. If they want to send them, they gotta take you to due process.
Right.
Hasn't happened yet.
Another question, is there a website for mental health services separated, just for the state of Florida, being separated by county?
I wish there was, but it's all in my head, so ask me. Call me.
I mean, I'm not looking for anything in particular, but it would be a really nice reference. I have a child with mental health issues too, actually, and I have several parents that will call me at different times and I need this or I need help with that. It would be really nice to have a few resources in
Yeah.
my head.
Yeah, that's one of the things we kind of try to do is, like Heather said, initially there isn't a place where there's a repository where all those answers are there, but when we get a call, we go out, we try to find the answer to it. And, I know DCF can be helpful sometimes and not helpful other times, but one of the things that we try to do is to go out and find out what people's issues are, what the barriers they're running into, be it the seclusion restraint, be it the least restrictive environment not being applied correctly, and we bring all those things up to them. One of the reasons that one of the roles that we think that we play as an organization is to go out and find out what these things are that are happening in different communities around the state, so we can go to the state agencies in Tallahassee and say, hey, this is an area that we really need to address because we've heard a dozen cases of this happening out there and they might not be aware of it.
I understand support groups are great. When you're a parent with a child with mental illness, getting to a support group or getting to time really is not really.
What county are you in?
I'm in Charlotte.
I know a bunch of Collier. Collier has a great program. But Charlotte Behavioral Health Center has a small program by one of the counselors there. And my son did it twice. If they can handle my son, yeah. But what they do is, after school, they have parents come in and kids come in, and they take parents into a group, and they take kids into a group. And that's the best support I've seen from parents around. But a lot of the NAMIs have support groups, and then there's the Federation of Families. Also in your area, you have the Central Florida Parents Center. And there's a woman, she'll be downstairs, her name's Alyssa Perry. She's a partner in policies graduate, and she's in your county. She's also a peer specialist.
Let me ask this. My youngest just turned 18. Is that no?
Well, you can become a peer specialist, Because as long as they were diagnosed before 22,
It is something I was just.
but now they need adult mental health services. But you can still always go to the support groups for families and parents. Because you share that connection, that bond.
Right, yeah, a lot of it's.
Yeah, John?
I'm kind of curious to know about the peer specialist role, Jim, you mentioned that professionalized, if you will. So can you give us an idea, the types of salary the peer specialist earns?
Pass?
Pardon me? Pardon me?
Pass? Okay,
Less
you want
than
the
a
honest
dollar?
truth, right?
What's projected?
Okay. In Florida, many of the people applying for the positions are on Social Security, and a lot of the employers take that into account. So a lot of these jobs are 20 hours a week, $8.50 to $10 an hour.
Right, so they're trying to stay below
They're
that.
trying to stay below that, and that's what their funding's been for years. And that was before Medicaid Delegate. The Medicaid reimbursement rate's pretty decent. So we're hoping that for those whose salaries can go up, they do. But, I mean, there's people that are working for like Magellan and Central Florida Behavioral Health Network and stuff who are making as much as the master's level tax at $50,000+ a year. So it really depends on where you're working and what you want to do. Personally, I want to have individual contact with people, so I'm at the bottom. Now, if I wanted to manage services as a peer specialist, I'm going to go there. But it's, I mean, there's people that work one-on-one. There's people that work on the crisis units to help with discharge planning, or maybe to calm somebody down when they're freaking out. Why the heck am I hearing you holding me down? There's people in clubhouses and drop-in centers, day treatment programs, all the way to outpatient and supported living. So it just depends on what niche you're working and what their funding level's really at.
Thank you. And I think your question is kind of evolving towards how would the Medicaid waiver impact that? You kind of asked.
Medicaid waiver will never touch it. Medicaid waiver is only for developmental disabilities.
Yeah, when they say the waiver in Florida, there's a developmental disability waiver. That's a special category that allows people in certain diagnoses to get services outside of the regular Medicaid system.
Yeah, this will be billable through the Medicaid handbook, directly through it.
But what about,
Yeah.
Yeah.
okay, but what about the waiver for people over 65?
I have not looked at their handbook.
Would
Yeah.
that,
That's Medicare.
no.
We have one.
it's
We have an aged and
It's
elderly.
child age and,
I haven't looked at that, and I don't think that one's been updated yet. They're in the process actually of updating, because we finally got it passed, it took forever.
yeah.
So they're in the process of updating all the handbooks right now. So some are in limbo, but if you go to the Florida Medicaid ACA site, they're finally starting to put them up, and that one will be there. I don't know if it's covered. If psychiatrists and stuff are covered, it'll probably be in there, because they really did add us. It was significant.
Wow, it's already
I know.
3:48. You had a question over here? Did you want to say something?
I was just, me?
Yeah.
I was just gonna tell you, I don't know if you guys know, but APD has a marvelous, I know, we have a marvelous, on our website, that resource directory. There's a lot on there.
Yep, and I go to that one a
Everybody
lot.
should go to- Have you used it? You can just
Yep.
put in, great. I mean, I have to say, we did a really good job.
Okay.
Make sure you use that and look at it.
Do you think there would be more funding for NAMI coming up or that type of thing? For instance, in our county, Sarasota and Manatee. I mean, I'm kind of just getting up on this as my children grew, their diagnosis has crossed over, changed, and so the mental health aspect of it that's come into play has been just in the last couple of years. They're in their early 20s now. So, you know, you're doing therapies and you're doing diagnoses, and now you're in a whole new realm. And I need retrained.
Totally.
I mean, totally retrained on how
Yeah,
I
it's
treat them.
completely different.
And so, plus they have an age change. You're talking about transitional, you know, wanting what they call the real things in life. And so I need to learn how to approach that differently too. Otherwise I create total havoc in the household, you know what I mean? But there's
there's waiting lists to even get the training class.
Yes,
And so,
local NAMI affiliates, most of them have been responsible for their own funding. I know they just tried to get $50,000 through for the state affiliate, and the governor vetoed that. But most affiliates do their own funding, like NAMI Collier, my executive director, fundraises like crazy, and we offer so much that no other NAMI will ever offer.
so I just need to move, right?
Yeah.
Well, no, because you actually live in a good area, but the services would not be with NAMI, because NAMI doesn't provide services. They provide education.
Well, that's a good start.
But there's other programs we can get you education through.
Okay.
And your local NAMI affiliate would contact their managing entity, which would be Central Florida Behavioral Health Network,
Okay.
to see if they'll help fund, because I know they help fund LEAP.
Okay.
So some have set up agreements like that, but it also depends on what they're providing. And so you just never know, and it has to be something they can bill under. But we work to make sure everyone's getting those services they need. I've said it before, I'll do it anytime. Somebody wants webinars, stuff like that, we can connect through webinars, right? We can have support groups online. We don't have to
So
all
can we
be
take
in.
that training class online?
If we can get somebody to train it, you've got a trainer willing to do it, I'll host it in a second. I mean, there's no reason not to, because we are all so spread out in Florida, and everything is so unequalized in Florida. And you have parents over here that have absolutely nothing, and you have parents in other counties that have absolutely everything. But there may be that person there that knows nothing about it, you know? They have to come together, and if that's the media we have to use, we can do that. But we will find you training, we will find you the education. It just may not always look like the same program.
Okay.
Does Medicare pay for peer specialists? I got Medicare.
I have not seen it, and it's gonna depend, it's not in the actual Medicare language. An HMO or,
The Advantage plans?
Advantage plans can choose to provide it.
See, my problem is you have no health insurance if you're on Medicare and do an HMO or an Advantage plan if you leave the state of Florida. And I'm constantly traveling to different states, and I spend a couple of months a year in New York, so I would have zero health insurance.
Well, it depends, because I travel, and I had to be really careful when I looked, but my Advantage plan covers me where I travel, and I don't pay anything extra for it. And the other thing is, if you move, right, and you're technically moving, you can contact the change your plan.
Yeah, see, I'm not, because my home's here. What it is 3 years ago, when they started it, reducing what the psychologists get, I haven't had counseling or anything for my own issues for 3 years. There are 0 support groups for what I have. The closest thing is the Alzheimer's groups, and they are only for the caregivers, because you're no longer human once you have Alzheimer's, or well, really, you're considered a subhuman and you are disenfranchised. Dr. Tanner at the Mayo Clinic, when I walked in and my diagnosis, which only took me 18 months to get there, said to me, I don't speak to patients. I only speak to caregivers. You're extremely diagnosed early. Come back in a few years with your caregiver and we'll talk about medications to control you. I have frontal temporal lobe dementia. You're normally dead in 2 to 6 years from diagnosis, because the protocol is extensive atrophy in the front temporal lobes by a neurologist. I got diagnosed by a neuropsychologist with acute EEG brain mapping and a neuropsych. Medicare won't pay for the neuropsychs I do every year, the QEEG. I'm talking $4,000 I got to shell out every year, and I'm on Social Security and a pension. I don't get paid for what I do with the special ed. And there are no support groups. And I'd like to talk to, what's supporting me is the parents of the special ed kids. It's, have you done your therapy today?
They're a strong
Yes.
network.
Yes. Oh, and the autistic kids, we exchange jokes. There's a requirement there. Every day we have to exchange jokes on the internet because they don't understand them, and I'm losing the ability to understand
Well,
them.
I'll tell you, like Jimmy was saying earlier, we're trying to bring, we don't need to separate by diagnosis. As long as you're going and talking to people that are going through something similar and can relate, that's what's going to matter. I mean, when I go to a mental health support group, probably nobody in that room shares the same diagnosis. They may not even have the same symptoms, but we're facing those same challenges, so we're able to make that connection. They may have absolutely no idea what I'm talking about.
And see, I haven't found any support, and the Alzheimer's groups don't want me in the room because I'm intimidating. I am similar to when they're caregiving, but I'm cognitively functional. And they don't want me in the group.
What area are you in?
I'm in Highlands County. Sebring, Avon Park, and Lake Placid.
No, it's not, because one thing, I know, she's thinking because you sound a lot like her. And I'm gonna tell you this, and we just found this out through doing family therapy, the lady who's talking to all of us and finding out mom has cognitive issues, she had brain injury, she has migraines and look like strokes, and that has completely, it's been a nightmare just driving. And so it's a lot of the same stuff. She does not fit into Alzheimer's support group. She does not fit in those senior center type facilities.
Yeah, and I'm 61.
Yes, she's 64. She doesn't fit going to the senior center, nor does her, with some of her issues, can she go, because it's not. We ended up finding through the therapist that she has found other individuals that have a similar experience, not the same diagnosis, because mom doesn't have she does not have a diagnosis to hold on to. But they ended up, she said, I've got 4 other people that don't fit a senior center mold. They don't fit an Alzheimer's mold. They don't fit a PTSD mold. But they need something to.
Can I say, you may be looking at frontal temporal lobe dementia.
They've tested that on her.
95% of people with FTD are not diagnosed until they're 2 to 6 years from death. And they are misdiagnosed with a whole bunch of things, and it strikes between the ages of 30 and 60.
She's been like this for 14 years.
Yeah, so.
The surgery that caused the migraines, and the migraines just got so bad.
But you may be you need an MRI of the front temporal
So
lobes.
what we can do is take our information, you can call me or email me, and with your permission, we can talk about it.
Yeah.
I can figure out something to post and something to email to see if there's anyone else going through the similar. And we'll see if we can make those connections.
I was on I had 11 people for a couple of years. We were on the internet, and we had a chat room. But a year ago, 4 committed suicide, and 2 of them ended up in daycare, adult daycare, and they're not allowed on the internet, and then it fell apart. And that was international, because they were in Australia and England and Brazil.
And I'll tell you,
it's
when
not
I
easy.
do adult parent support groups and stuff, I mean, there was one group I ran for a year. I never had a meeting with over 3 people, and it was never the same people. And then one time I went in and there were 15 people. You just never know, but hopefully we can find someone that can connect. And that's definitely what you're looking for, is that connection.
Yeah, I need somebody, because I need to have my own support. And that's why I came, because I figured, let's see what you got.
And there's so many individuals that have been diagnosed with early Alzheimer's now that they don't have a support group, because Alzheimer's people don't want them there because they're all caregivers.
They're functional.
So these people who are still functional and they've been diagnosed with Alzheimer's early, they don't have support because they don't, so it's out there. You gotta kind of you gotta ask and everything.
And there's one people normally don't know about, and they don't want to call it because of what it's called. We have a national suicide hotline. You can actually call and rant. They're going to listen and they're going to talk to you. They don't care why you're calling, who you are. They're going to talk to you.
And a lot of them don't understand why we opt for suicide and we discuss it among our group. That's why it's really hard to be in a support group when you're discussing committing suicide and people don't understand. It's not that we are suicidal. We're discussing end stage because we don't want to go to the end.
But we do have a hope line, and you can call and talk. And then the other one I refer to, because we don't have one in Florida, is Georgia has a peer specialist. And it's peer specialist answering all day, just
On the phone?
on the phone.
I should ask on the web.
And a lot of counties also have a well check line, and it's just somebody you can schedule and they'll call you, hey, just want to make sure how your day's going. Do you need to talk? No? Okay. And next day, hey, you need to talk? Yeah, and they'll just talk. But there are, if we can't get you something local to you, we can get you something.
All right, because I do want to get something for me.
I know you guys need to wrap up. Are you available just for a few minutes after?
Of course I am, yep, and take the sheets of paper. And if you have a disability rights Florida survey, I can take those.
One thing I want to mention before we finish is if you guys are interested in mental health and trauma specifically, the keynote tonight, Tonya Kane, she's a trauma survivor. She's going to be talking about the relationship between trauma and behavioral health. It'll be really interesting and right up the alley of what we talk about here. So I encourage you to attend that if you're able to. Well, thanks everybody for coming. It was a good conversation. I was very happy to have you.
Thank you very much. And please take our stuff.
Yes.
Take our stuff.
Include these t-shirts. Who did not get a t-shirt that wants one?